Well, good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. One of the biggest issues that I think is facing us, and we're not paying nearly enough attention to, is some people have called the coming tsunami of long-term care issues. As the baby boom gets older, as this demographic bulge ends up getting into their not just seniors' years, but later senior years, I think we're going to have a huge amount of people that are going to be in need of home health care, institutional living, hospice care, help. We're going to have an issue in regards to pensions. We're going to have an issue in regards to healthcare costs. We're going to have an issue in regards to just care. And so I wanted to reach out to someone that's an expert in this regard. Candace Chartier is her name, and she's got decades of experience. She's a senior executive in healthcare across Canada. She's held portfolios and was responsible for leading and implementing various organizations' ongoing commitments to quality and care across the healthcare continuum. Candace, welcome to the show.
Hi, thanks for having me.
So you think that this is a big issue we're not paying enough attention to. Is that correct?
Yeah, I think there's a lot of attention on older adults and our aging population, but I think there's a bit of a ticking clock, and it's getting more so in the forefront of decision makers. I mean, if you look at, a couple of years ago, there was about 2.5 million Canadians over the age of 65, and they're saying by 2046 that's going to be almost 4.5 million.
So doubling.
Doubling. And but there's also a large degree of interest and support in looking at solutions. There's been various polls done, and anywhere from 35 to 40% of Canadians have this supporting older adults as the number one concern.
You've got quite a history in this sector, and so I think it'd be helpful if you describe a little bit of it. You've been President and CEO of Providence Living, Chief Executive Officer of the Long-Term Care Association, Chief Operations Officer of Omni Healthcare. Give me a sense of your experience in this long-term care area.
Yeah, I kind of say I grew up in long-term care. I was with Omni for 17 years, started as an RN, moved up in through the ranks and ended my career there with as Chief Operating Officer. But it was an incredible experience. Got to build a couple of brand new long-term care homes in the Ottawa region. And then I went on to be CEO of the Ontario Long-Term Care Association for 7 years and chaired the Canadian Association for Long-Term Care. So really advocating at the provincial and the federal level. And then moved on to Providence Living, which was really incredible because they are building the first publicly funded long-term care home based on the concept of a dementia village in BC in Comox. And it's a totally different way of building for the future of long-term care with a social model.
Fascinating. And I understand you've got some personal experience with long-term care of your own parents.
Yeah, not only are we aging, but the incidence of dementia and cognitive impairment is expected to double as well with Alzheimer's and related dementias. And one of the reasons I had to leave BC and come home to Ontario was my father fell ill. And when I flew home, I found out the hard way that I was his power of attorney for care and financial. We found him in a state of neglect, and he was being abused. And I mean, here I'm supposed to be this, great advocate for senior care, and my dad was living a bit of a nightmare, and I didn't even know it. So it just kind of pushed me back about 1,000 steps to relook at senior care and how we're caring for older adults across our country, because there's so many gaps that they can fall into. And, I think we just have to be very proactive and look at, how we can approach this aging demographic with, more focus on quality of life.
What are the solutions?
Well, I think there's some really good solutions that I think there's a lot of buy-in around. And really looking at expanding services to enable older adults to live at home as long as possible before you actually have to go into long-term care. So, looking at home care, community care, mental health and addiction supports, technology. One of the things you're seeing are expansion of long-term care, community hubs, caregiver respite, and caregiver supports. I think if we really look at, expanding all of those areas to wrap services around seniors where they live, whether it be at their own home or a retirement setting or supportive housing, wrapping those services around them and filling those gaps to see if we can keep them out of long-term care until they absolutely need it, and keep them out of the emergency departments by having those services come to them.
So staying at home, you think, is the solution, and therefore providing more services that allow people to stay at home safely and healthily.
Yeah, I mean, it's taking a more proactive approach. It's, looking at seniors' needs upstream before they feel like they have to call 911 and go to an emergency department, before families get too mired in looking after their loved one that they don't even know they're in a state of burnout because they're so close to it. I mean, we need to look at more transitional care services and more transitional care settings. When I saw my dad, and while he was in that hospital for 2 weeks, which he got incredible care and the whole supports that team provided us, as soon as he went back to his house, it just went downhill from there. And I tried to get him to move in. I put the wheels in motion to move back to Ontario. My siblings, we all looked at, okay, we can equip dad, we'll turn this room into a bedroom. But even in the short term, before I could get back to Ontario, we needed somewhere to put him. We could not find a transitional bed. We couldn't find a respite bed because they're just bursting at the seams. We've got almost 43,000 people on a wait list to get into long-term care. So if we could look
Hold it. In Canada or in Ontario?
That's just Ontario.
43,000 on a wait list. How many years of a wait list is that?
Well, it depends. That's the other piece, is that our province has so many vast differences in regions. You've got urban, you've got rural, you've got northern. They all come with their own unique challenges and access to services. So that's why, any solution we put in play has to be the solution that follows that older adult, not painting every solution is going to work for every area in our province, because there's unique challenges in rural and northern Ontario.
43,000 people on a waiting list for a long-term bed. That's unbelievable. We got to take a break for some messages, and we're going to come back in just 2 minutes with Candace Chartier talking about the long-term care issues that we're all going to face. And I guess, as lots of people say, it's better than the alternative, but still, it's a big issue that we're all going to be facing sometime soon, and for some of us even sooner. Stay with us, everyone. Back in 2 minutes. Welcome back, everyone, to the Brian Crombie Radio Hour on Saga 960. My guest tonight is Candace Chartier, not Cartier, as I said before, but Chartier. I apologize for that. She's got a couple decades of experience in long-term care and other healthcare settings. She has been a registered nurse and an administrator and a CEO of numerous different organizations. Candace, if we're doubling the number of people that are in this age demographic in the future, from, I think you said 2.5 to 4.5 or something like that million people, can we solve this with institutional care buildings, or is it impossible? I've talked to some people, I've interviewed some people that say an institutional solution is just impossible, that we'll never actually be able to build enough seniors' homes, long-term care facilities. And so there's no choice. We have to figure out how that people can stay at home. Plus, not everyone, but a lot of people want to stay at home as long as they possibly can. So what is the solution?
So definitely, it's not just building more long-term care beds. Yeah, we do need more long-term care beds based on what areas of the province and the country require them. I think it's more expanding those other settings. And, I had alluded to transitional settings, but I think, creating more affordable housing, seniors housing spaces, having more community hubs where maybe the long-term care home is providing services like assisted living, supportive housing, retirement, and looking at more collaboration in those communities where whether it's a hospital or a long-term care home, having that Ontario Health Team concept, which is, looking at a specific community's needs, and, working together with your hospital partners, your community care partners, your mental health and addictions, and just, coming up with a really robust transitional process where only the seniors and older adults that truly need long-term care can get into a long-term care bed, and making that process easier so you can admit to a long-term care bed from a community organization and not just having one transitional setting to get into long-term care.
I've been told that government doesn't fund home healthcare nearly enough, home long-term healthcare nearly enough, and that they've got a bias between not-for-profits and for-profit provision, and that nurses, aren't paid enough, that we're not qualifying foreign trade nurses quickly enough, and it's just that government's just not willing to address this issue or hasn't been proactive enough in addressing this issue. What do you say to that?
Well, that's a loaded question. I guess the way I'm looking at it is we are in a global health human resource shortage. We have been for many, many years. I was advocating for health human resources 12 years ago, 10 years ago. And I think there's been huge investments in the last couple of years into getting more seats in medical programs, getting more seats in registered nursing and registered practical nursing. There's a whole bunch of initiatives to upgrade PSWs to RPNs, training PSWs.
Sorry, let me interrupt.
Yep.
What's a PSW? Can you explain that to everyone? And what's an RPN?
Yeah, so personal support workers, they're kind of the eyes and ears of our space. They're the care workers that are there 80% of the time, giving that hands-on care to our seniors, regardless of the setting. They work collaboratively with registered practical nurses, RPNs, as well as RNs, registered nurses. And I think that, that collaboration and working together, that's how we're going to support this HHR crisis. But the really important thing on top of that is it's not just bodies. We've got to look at the innovations and technologies that have surfaced, especially through the pandemic, in addressing all of this, all of these needs. And that's where I think our government and our decision makers have really stepped to the mark, because they know that, yeah, we can do everything we can to get more health human resources in place, but let's look at what innovation and technologies can support that. And one of the recent innovation announcements was the $40 million for the Models of Innovation Fund, which everybody's waiting for right now. So it's on everybody's radar. And I think as a province and as a country, we're really starting to look at how we can do things differently.
Give me a sense of what are some of these innovations that could help.
So an example is look at wound care. So somebody could be a diabetic living at home. What comes with that is, loss of sense and feeling in your extremities, depending on how bad it is and how advanced. And, maybe they have a foot ulcer that they don't feel. And by the time they actually, look and see that they've got this problem, it could be weeks to months to get a specialist to look at that. There's an innovation now that I was involved in a pilot in a long-term care home, and it's looking at technology where you take a picture of that wound, it goes immediately to those skin and wound specialists, whether it's a plastic surgeon, you name it, and it diagnoses it. It has a tutorial on, what you need to know about this. Here's the treatment option, and here's the referral process, and here's your your closest local referral source to help you out. That's in a matter of seconds. And what the art of the possible with something like that is that personal support worker going out from an agency or a community care program doesn't have to have that skill set right there and then. They could have that registered staff that supports them because they've got the technology right there to take a picture. So it's things like that where, dermatologists trying to get a dermatology appointment. I'm fair. I've got, skin cancer risk. I went on to get a dermatologist appointment and I was on a 12-month wait list. And when I discovered this technology, it was like, oh my gosh, it's incredible. But even programs where another company were looking at how to predict and intervene for falls before a fall actually happens in the community, using technology that measures your gait, technology that ensures you can hear appropriately, and technology that does cognitive brain mapping, so that we know, a family member could know what degree of risk their loved one is and wrap that care plan around it before they actually fall and break a hip or break a bone that ends up costing the healthcare system thousands and thousands of dollars.
I'm astounded that something as simple as a fall is as complicated and tragic as it is. I hear constantly about people that aged people that have had huge healthcare problems, if not deaths, because of falls. There's got to be a better solution.
Yeah, it's a fall with an older adult can be severely debilitating. It could be that tipping point where you may not be able to live at home any longer and you end up in an ED and then ultimately a long-term care home. If we can, wrap these services around people in their home, like go in, do a quick assessment, an environmental assessment. Okay, here's what your scoring has shown us. So you know what? We're going to bring in an occupational therapist to work with you and a physiotherapist. And what that does is it shows, based on their scoring with these technologies, that we don't have to just call on the primary care provider, the physician, because some people don't even have a physician. So what it does is it gives you that algorithm that shows which professional support you need, so that you go to that right support instead of having to go to the doctor and then the nurse and then these services. What it is maybe you just need that OT and the occupational therapist and the physiotherapist to come in, do strengthening exercises. We'll do an environmental assessment. We'll give you all the tools you need, whether it be grab bars, transfer poles, falls mat, you name it. That's what we can do. So we're utilizing our scarce health human resources a lot more efficiently.
So I had a hip replacement operation, and both the surgeon as well as the occupational therapist urged me to just not be dumb and use handrails on stairs all the time, even when I no longer needed to, and use a cane even longer than I needed to. And one of them said, the biggest secret you've got is go out and buy a fun cane so you don't feel embarrassed using it, and use it just to make sure that you don't fall. Should we just be giving fun canes to people?
Well, fun canes might work for some, but I fell on the ice and broke my ankle, broke it really bad last March. And, I think it's whatever's there to help you live your life. I'm a high functioning, active, walking a mile a minute person. And that completely took me out. And the best thing that ever happened to me was my physiotherapist coming in and my OT and hooking me up with a wheeled walker, sorry, not a wheel walker. I'm drawing a blank. Anyway, it's a knee walker. So I could zoom around with this little piece of equipment that was incredible and enhanced my quality of living within seconds. And yeah, I made it fun. I ended up, going to a conference on my, on this knee walker, and I blinged it up with one blingy shoe that matched my blingy blazer. But what it also did is it opened my eyes to the whole disability side of the equation, which wasn't even top of mind. And it was something so simple as going to a conference and trying to get from the front door to the conference through a hotel with all that carpet. I struggled, and I'm fit and active and have, good muscles. I couldn't imagine a senior trying to navigate a carpet in a hotel with
Yeah.
a walker. Like, it's things like that that until it happens to you, you don't appreciate the whole picture.
You mentioned the issue in regards to people using emergency rooms and staying in emergency rooms and hospital beds because they can't get into long-term care facilities. What's the solution there?
I think the solution is that, expanding those services, having those services available in each community, and wrapping that care around the client that needs it. One of the most incredible supports that I had with my dad while I was sitting in British Columbia was my local EMS, Julie, and I will be forever grateful to Julie, because she would go in and check on my dad. She would go in, she would get there with the ambulance, and he loved her, and she would take his vitals, she'd listen to his chest, and she would call me. And it was so comforting because I knew I had that check. And my dad lives in this little tiny town of Norland, Ontario, or lived in Norland, Ontario, which is typical rural Ontario. But having those supports go to him kept him from having to call 911 and get the ambulance and end up in a merge.
I've in living at home, I've been told that some of the biggest problems are things like banking and going to the grocery store and going to the pharmacy, and people want to stay at home, but just some of the basic things that you got to do to exist in life, we haven't made simple.
Yeah, one of the things that we're looking at in my community, where our community is building a big wellness center, and we're looking at the possibility of doing low-income senior housing in like a tiny house concept, right on the same property, and then having a host that we call the care concierge. And that care concierge is there for that community of low-income seniors. And same thing, they can go and get their groceries for them. The wellness center has everything there when it comes to their wellness. So rehab, pharmacy, you name it. But all of those little minutiae of banking and all of those things, there's a lot of different companies out there that are really gearing their services to that care concierge concept. And the organization I just finished working with, they just built an incredible long-term care home, but now they're looking at that community hub concept and how they can serve that community within however many kilometers radius, and work closely with the Ontario Health team and be that solution. And offer those services not only to the community, but have community come into their building, but also having other long-term care homes that may not have the degree of services that this one does, and supporting them as well. So it's really integrating with all of your care partners based on what community you're in.
Are there other things that we need to be thinking of? I had a Parks and Recreational consultant once tell me that seniors love to get out into nature and into parks, and yet we don't build our city parks conducive because two of the biggest things they need is park benches and convenient, accessible washrooms.
Yeah, and you know what? That I was actually quite surprised. There's one of the provincial parks, I can't remember the name, but they are looking at incorporating cabins, or is it Quonset? Like, they're building structures where seniors can go and enjoy one of Canada's parks. I have seen that strategy is happening. The other thing is, community supports, like in our local community, you've got community care doing fall tours up through Haliburton Highlands when the trees are changing. So you've got organizations that are really tapping into the senior population and helping those older adults, whether they live at home or not. And then you've got senior friendly cities. So there's a lot of initiatives that government has that, the municipalities can tap into to enhance their communities to be senior friendly. So I think we're on the right path. It's just a matter of continuing what we're doing and building on it.
I think one of the biggest issues is, in addition to just the number of people, is this dementia and Alzheimer's issues that you mentioned. So we're going to take a break for some messages and come back in 2 minutes. I'm going to ask Candace about this issue because I think it's something that a lot of us have been touched by. Stay with us, everyone. Back in just 2 minutes.
Okay.
Welcome back, everyone, to the Brian Crombie Radio Hour on Saga 960. Our topic tonight is seniors, long-term care. What are we going to do with the coming tsunami of a baby boom that are aging and are going to need care and someplace to live? Our guest is Candace Chartier. Is that correct?
Chartier, yeah.
Chartier. Not Cartier, as I mispronounced initially. I apologize. She's got really 2 decades, if not more, experience in this area. She has been president and CEO of Providence Living, chief executive officer of the Ontario Long-Term Care Association, chair of the Canadian Association for Long-Term Care, chief operation officer for Omni Healthcare, and CEO of Safe Haven Consulting Inc. Whew, lots of experience. Candace, you mentioned that the number of dementia patients, I'm not sure is the right word, but people with dementia or Alzheimer's is doubling. Is that as a percentage of the population or in absolute numbers?
It's absolute numbers. It's it's to be expected with the demographic shift that we're facing. Typically it is the older adult that develops this cognitive decline and dementia and related dementias and Alzheimer. So I think we have to be really proactive in all of the solutions that we're looking at going forward, because this is going to be one of the top priorities.
You see, I agree, because I think actually I wouldn't have been surprised if you said it's actually as a percentage, because I do think that as we've addressed other issues like cancer or heart attacks or other things, people are getting older, living longer, and are being more impacted by things like Alzheimer's or dementia that they may have had, but they passed away before they got to that stage in life because of cancer or heart attacks or whatever it was that they previously were impacted by. And there doesn't appear to be much to do with dementia or Alzheimer's, is there? Like, we can solve cancer, or try to. We can deal with heart attacks and cholesterol and issues like that. But what do we do about Alzheimer's and dementia?
I think we're getting close. I think the research world is, this is probably one of the most prevalent issues we're dealing with. I have worked with different partners around, looking at, technologies and innovations that, can support somebody living at home as long as possible with dementia. I think that it's really tapping into the expertise that we have in our province and our country. There are incredible organizations out there like Ontario Shores and CAMH, and the basket of services that they have, and how, if we partner with these organizations and look at, what services, what programs can we put in play to support people to live at home, and what digital monitoring utilization we can look at. How can we do outreach with mental health and addictions, and even the homeless population? How can we meet the needs of people who have no place to live and are dealing with this, as well as maybe a mental health issue on top of the cognitive impairment.
I went to one expert on dementia who said that one of the simplest things you can do is keep active and keep socially active. And the comment was, you don't stop dancing when you get old. You get old when you stop dancing, or you don't stop playing bridge when you get old. You get old when you stop playing bridge. What do you think about that? Is that too trite?
I love that. Even myself, like, I encourage my mother and my in-laws. My in-laws are in their late 70s. They've lived with me for 19 years. And painting by numbers, coloring, puzzles, brain teasers. I mean that cognitive stimulation. There's lots of research that supports that. And keeping yourself as healthy as possible, because once you go down the road where maybe your chemistry isn't where it needs to be, that also adds to issues and enhanced difficulties. One of the things I had mentioned was hearing loss. Hearing affects cognitive ability immensely, and making sure that these seniors are being screened for hearing loss, because that can also add to instability, falls, cognition impairment. So it's really that whole proactive piece that I talked about, and making sure that we approach it that they're safe, and that we're going to do everything to make sure they're safe. And that's where you can go into somebody's home, and you can put technology in to support them, to remind them to take medications. There's a technology that can sit at their bedside and remind them to take their meds, it dispenses their meds, 24/7 access, so that if they are confused or they need something, it's there. Another technology where, it's a tablet. They may not be able to dial the phone or whatever, but they see their loved one on that tablet, and they just press the picture of the loved one, automatically goes to their loved one to connect wherever they are in the world. So it's that exciting side of this problem that we just need to get a path onto how we can get all of these in place and share the incredible best and promising practices that are out there, and spreading it across our country.
Candace, given everything we've talked about, is the government doing enough? Are we funding long-term care to the extent we need to?
I don't know if we'll ever be able to fund long-term care to the extent we need to, just because of the sheer numbers of seniors coming down the pipeline. There's going to have to be significant changes. I think the last few years have had historic investments in long-term care. I think the pandemic really opened, I think, our eyes on the changes that were required in serving older adults, and it just made it worse. So I think we learned a lot coming out of COVID. But we do need more investments. We need more strategies around how do we build for the future, more capital strategies. We need more investments in innovation and technology. I think that the government has incredible insight on some programs that they've put in play. But I also think that everybody's got to roll up their sleeves, because between now and that additional 2 million seniors that are going to come on the pipeline for services, we need to start doing that now, and we need to plan and be more strategic around how we address those future needs that are coming.
I've been told that with this, and you called it 2 million, but that's an astounding number of additional people. But that with whether it's 2 million or whatever, growth in the need, the demand for these kinds of services, that not-for-profit organizations will never be able to meet that demand, and yet we have this bias against for-profit, and we, from understand, the provincial government pays less for a nurse that's with a not for a nurse or a PSW that comes from a for-profit company versus a not-for-profit company. Is that true? And is that negative to solving this issue?
Well, in long-term care specifically, every long-term care bed gets it funded exactly the same. Whether you're for-profit, not-for-profit, charitable, it doesn't matter. You get funded from the government exactly the same amount. I think it's more the disparity between community health human resource workers and long-term care and acute care. There is differences in wages, significant in some scenarios. Wage parity is a huge issue that we do need to look at in order for us to effectively meet the needs and effectively have a health human resource strategy. And, you know, I think that if we work together and look at, you know, who's providing the services and, you know, what are the skill set that are required, allowing people to work to their full scope of practice, you know, having the ability to put the right people in front of a resident based on what their needs are. So instead of saying, well, an RN has to do this, no, maybe the RN doesn't have to do that. Maybe an RPN can do that, and with support with their personal support worker. But definitely we do have to look at the wage parity issue, because the community support workers and community health human resource workers, they do have a significant gap, even compared to long-term care and then more so acute care.
Give us, if you could, some just practical suggestions. If we've got family members that are reaching that stage where they need the care, given your experience, given your knowledge, what are some practical suggestions for us all?
Well, I mean, when I looked at what my dad needed, I think the biggest thing here is navigating the care system. I've been in healthcare for over 30 years, and it was tough for me to navigate and find the right supports that I needed for my dad. But, you know, being more proactive, if you do have elderly parents, looking at where they live and start looking at what their needs are, what services are available. You would be shocked at how many services are available in your community that you just don't know about. And the other thing is, you know, if you can start looking at, you know, what services you can purchase. And I know that not everybody can purchase, but I couldn't get enough hours, publicly funded hours for my dad's care. So I hired a private personal support worker to go in and help my dad. If you can't do that, then what are your other options? Your local community care, your local EMS. So I think it's more, and I think it's going to get better with the formation of more Ontario health teams, because I feel that the Ontario health teams, the ones that I've been involved with, really have a finger on the pulse of what that community need is, but looking at how they can have that navigation role built into those teams, so that somebody who doesn't know how to navigate care needs could just call that one person, that one department, and get the support that they need.
I think one of the other things that people, physicians and other experts have recommended to me is that a lot of how we're going to live out the rest of our life is dependent on some of the lifestyle choices we make in middle age. And so we've got to get exercised and not be obese and all those kinds of things. Do you agree?
I do. I agree. And, you know, excessive use of alcohol. There's been studies that have just recently come out, and how that can affect your older years as well. I think that, you know, you see even with weight loss, you see what's happening now. People are you know, going on medications to lose weight because they know that that's going to impact their longevity. And to the degree where, you know, some of these medications are short supply because of that. But I also have some very close colleagues who, you know, they have dropped that 40 pounds or 50 pounds, and all of a sudden they're not taking they don't need their blood pressure medication. They don't need their cholesterol medication. So, you know, it just shows that I think our society is more focused on getting healthier because they see, you know, what could happen. And I think, you know, government, Public Health Ontario, you name it, that messaging is constant. Ontario Medical Association, they're all out there, and, you know, they're all pushing this research and, you know, these suggestions forward. And I think people are starting to listen, but we also have to make sure that we have resources available for everybody that may not be able to afford certain services. And that's why I think, you know, we have to come up with a solution that wraps services around each and every individual, regardless of where you are in the province and regardless of what your socioeconomic status is.
Candace Chartier, thank you so much for joining us tonight and making sure that we're aware of this big coming issue. An issue today, but it's going to get even more important in the future. We're going to take a break for some messages, and I'm going to come back with my own thoughts on this important topic in just 2 minutes. Stay with us, everyone. Thank you, Candace.
Thanks.